Hello, welcome to Lotus Medics. I'd like to introduce myself. I'm Dr. Sachin Kotasthane. I'm an obstetrician and gynecologist in New South Wales, Australia. Today we're going to talk about fibroids or tumors which are called as myomas or leiomyomas. Fibroids are non-cancerous benign lumps of the muscle of the uterus. They can be of several shapes and sizes and can be present in different locations inside the uterus. When they are present under the lining of the endometrium or the lining of the uterus, they are called submucosal. Sub is under, mucosa is the lining of the uterus. So submucosal fibroids are present inside the uterine cavity, and these are the fibroids that are most responsible for problems like heavy or abnormal uterine bleeding. They can also cause problems in conceiving, or in certain cases, they are also responsible for miscarriages. Let's look at another type of fibroids. These are fibroids called subserosal fibroids, or fibroids that lie more closer to the outer surface of the uterus. Sub meaning under, serosa is the outer lining of the uterus. When these fibroids grow to a very large size, they can be responsible for pressure symptoms both on the bladder or the bowel or general discomfort. The third type of fibroids are called intramural. Intra is within, mural is the wall. So these fibroids are present within the wall of the uterus. Fibroids can be of different shapes and sizes. They can be as small as a pea or as large as a rock melon, measuring several centimeters. Fibroids can also be classified as pedunculated, which is hanging by a stalk, or sessile, which is flat and flush to the surface. They can also be present and classified depending on whether they're present in the uterine wall or in the cervix, as well as by different positions within the uterine wall. Fibroids occur in about 25 to 50% of women. So you could potentially have a fibroid and not know about it for several years. In fact, in several instances, fibroids are only incidentally discovered when you've had an ultrasound scan. But not all fibroids are symptomatic. So you may have a fibroid and not really suffer any problems or symptoms from it. We don't exactly know why fibroids occur, but we do know that they do respond to hormonal influence. Let's talk about some symptoms that women with fibroids may have. You may have a fibroid but not have any symptoms. And if you don't have any symptoms, it may not necessarily be required to remove or do anything interventional in terms of the fibroid. However, fibroids can have certain bothersome symptoms. As mentioned before, submucosal fibroids can be responsible for very heavy or abnormal uterine bleeding. The bleeding might be quite heavy and cause anemia and significant affection of quality of life. Fibroids, when they grow particularly to large sizes, can also cause pressure symptoms. This may be in terms of pressure of the bladder, which means that women can have frequent urination or difficulty emptying the bladder or difficulty passing urine. They may have pressure on the bowel, causing constipation or difficulty in evacuation of the bowel. Sometimes pressure on blood vessels can also increase the risk of clots in legs or lungs. Some women can have difficulty conceiving, especially if they have a fibroid within the cavity of the uterus. These type of fibroids are also responsible for miscarriages. Fibroids don't usually cause pain, but if they are quite big in size, they can cause discomfort. Pain in the fibroid is usually caused by ischemia, which is restriction of blood flow to the fibroid, especially in one that is rapidly growing. Fibroids can also grow in pregnancy and can cause problems like abnormal presentation of the baby, like in a breech or transverse position, increased risk for cesarean section, and increased chance for bleeding, also called postpartum hemorrhage. The risk of cancer in a fibroid is exceptionally rare, But a rapidly growing fibroid, especially in perimenopause or menopause, is a cause for concern. Let's talk about the diagnosis of fibroids. Fibroids can be diagnosed in several ways. They can be diagnosed via clinical examination, especially if a fibroid is really large. But most fibroids are diagnosed with an ultrasound scan, which helps in reaching the initial diagnosis and also helps in locating the fibroids. An MRI is also a recent and more accurate tool in terms of mapping the fibroid, as well as ruling out any changes in the fibroid like calcification or degeneration, as well as ruling out a malignancy. A hysteroscopy and laparoscopy are also tools in diagnosis of the types of fibroids and are also used as part of treatment. Let's look at some treatment options for fibroid uterus. The first option, as I discussed, is to do nothing, especially if the fibroid is small and if there are no symptoms. The fibroids can be left well alone and no further treatment or intervention is required. The second option is a hormonal treatment. This is often aimed at regulating and reducing menstrual blood loss and can sometimes help in also shrinking the size of the fibroid by a little. These treatment modalities include the oral contraceptive pill, the Mirena intrauterine system, and other options like the GnRH analog injections. Let's come to another surgical treatment option. This includes myomectomy. What is myomectomy? Myoma, which is fibroid, and ectomos, which means removal. So essentially, this is surgical removal of the fibroid from the uterus. This is a major surgery and is usually undertaken in women who want to have children, as it is a uterine sparing surgery. This breaches the uterine wall, and so in a lot of cases women might need to have a cesarean section as a mode of delivery in subsequent pregnancies. There is a risk of fibroids redeveloping, and there's also risk that you might require further surgery as you develop new fibroids. This process of myomectomy can either be done by hysteroscopy, laparoscopy, or laparotomy, depending on the size and location of the fibroids. Another option of treatment is uterine artery embolization. This involves blocking the blood supply to the fibroids by passing a catheter or tube through a vessel in the groin and accessing the blood supply to the fibroid and blocking it. This causes ischemia of the fibroid by restricting its blood supply, and it usually causes it to shrink by around 40 to 60% of its original size. The effect of uterine artery embolization on pregnancy is not very well known. Hence, women who are keen to get pregnant may want to opt for some different options. This can sometimes cause nausea, fever, or severe inflammatory reaction or infection, rarely necessitating hysterectomy. Let's come to the last option, which is a hysterectomy. This is more definitive surgery and is usually reserved for women who have completed their family. A hysterectomy for fibroid uterus is usually either done laparoscopically or via laparotomy, depending on the size of the fibroids. When done via laparoscopy, the fibroid uterus is disconnected from its attachments, put in a bag, and morcellated or minced using a contained morcellation technique. This makes sure that the process is contained and made safe. I hope you've learned a little bit about fibroid uterus in this educational video. Please do not hesitate to look up some more information on the Lotus Medics website. Thank you very much for your kind attention.